Why is it that some people are perfectly fine including milk in their diets, while others are lactose intolerant and can't drink milk without discomfort? And what is lactose anyway? My name is Dr. Natalie Colson Shilton, and I'm a nutritionist, dietitian, geneticist. In this video, I'm going to answer these questions. Most of us are born with the ability to digest lactose, the major sugar in mammalian milk, such as cow's milk. But many of us lose that ability to some degree into adulthood. This happens due to variations in the gene for lactase. The lactase gene codes for the enzyme that breaks lactose sugar into two simple sugars, glucose and galactose. These gene variations affect how much lactase enzyme the gene makes. So if we have just a small amount of lactase enzyme produced by the gene, we may not be able to break down the lactose in a large serve of milk or dairy. It then goes into our large intestines undigested, where our gut bacteria ferment it, producing gases such as hydrogen and compounds that can cause pain and diarrhea. Nevertheless, even with reduced lactase gene function, lactose intolerance, most people can tolerate a small amount of lactose before symptoms occur. Lactose intolerance is commonly tested for by a hydrogen breath test. This is because the undigested lactose causes bacteria in our large intestine to produce more hydrogen. Although this method isn't perfect, it's certainly less invasive than an intestinal biopsy to detect the lactase enzyme activity. So are there dairy products that are easier to manage for people with lactose intolerance? Well, yes, absolutely. Aged cheeses are a good choice, as are yogurts with live cultures or probiotics, along with fermented dairy products such as kefir or quark. This is because the bacterial cultures have already worked at breaking down the lactose. If you use lactose-free milk and yogurt, have you ever noticed how it tends to be a little sweet? That's because we can taste the sweetness of the glucose sugar and to a lesser degree galactose. Those two sugars have been released from breaking down the lactose sugar, which is not as sweet. If you'd like to check if you are lactose intolerant, always refer to an evidence-based health professional for advice. I hope you've enjoyed this video. Thank you for watching. If you'd like to know more, make sure you subscribe to my platforms.